Doctor Radio is SiriusXM Doctor Radio.
And now, from the heart of the NYU Langone Medical Center, here is Dr. Dennis Goodman.
Good morning, everybody. Welcome to Doctor Radio on Sirius 114 and XM 119. I'm really excited this morning because we have a wonderful show, part of our wellness program and wellness revolution. And I'm going to be talking to two fabulous and amazing guests. I am very interested in bringing people together that are practicing integrative and holistic medicine, and then bringing patients or clients that they have onto the show to talk about what they're doing. So instead of people saying, you know, this is great and that's great, we actually get somebody on board that can actually talk about their own personal experience and what that person's done for them. And we have a real amazing lineup. I have on the show this morning Mr. Grant Hill, who is the Phoenix Sun superstar, all-star. For those of you that aren't sports fans, I think there's very, very few people out there that don't know who Grant is. An amazing record. He won 2 NCAA titles for Duke in 1991 and 1992. He's been a 7 times NBA All-Star, an amazing career with the Detroit Pistons, and then went on to Miami and played with Magic there, and then is now playing with the Phoenix Suns as a forward. Welcome, Grant. I must tell you, I was listening to the news early this morning. I was absolutely so excited because there you were in the very last second of the game last night, actually against the Hornets, where you blocked the ball. And as far as I'm concerned, it wasn't goaltending. What do you think?
I agree. It was a clean block.
It was great. And you know what? I said, hey, that's my man. I'm going to be talking to him in 2 hours. I can ask him for himself. So it must be a great feeling when you, it must be something like, when that last putt, at the end of 72 hours of golf, you just sink that putt and the guys are left lying after, sitting on the court like that. So it must have felt great.
It did. It felt good. It felt good to get the win, and it feels even better to be here talking with you today.
Grant, you've had an amazing career, and I just wanted to congratulate you. I'll tell you why I'm so excited to talk to you, and then we're going to bring Dr. Jain on, because I know about your career, and I've read about you, and you're an absolute inspiration. I just want to read something that I read about you, because I want the listeners to understand and to know just what kind of guy you are. And what was said is that you have a strong work ethic, you're humble, and you're gracious, and you always have a humble and gracious attitude. Your academic achievements and strong family ties combined with your overwhelming success and good sportsmanship on the court and off the court make you a perfect role model. And I just think the fact that you're even on here this morning, you're a busy guy, you played hard last night, is just testament to the fact that you have this real commitment to want to give something back. Am I right?
Well, yeah. I mean, definitely. I've been fortunate to have a lot of people help me throughout my career, and more in particular, I think in this journey and trying to live a healthy lifestyle, and to be able to hopefully shed some light and share some of my experiences, and some of the things that I've been able to do as of late within the last couple of years out here in Phoenix with Dr. Jain. Hopefully others will benefit from that, and so I'm just here doing my part. Hopefully we can have some fun today, and
that's it. That's exactly what we want to do. Grant, just before we talk to Dr. Jain, I know you've had about 5 surgeries on your ankle, and I know that's a big thing, and people ask you about that all the time, but I just think it's mind-blowing that you are at the highest competitive level of sports. You've come back from so many injuries, and it's just an absolute amazing thing, and such an inspiration for so many people. There's so many athletes that get injured and they just can't bring themselves back. So do you think it's a huge part of it's the mind, or do you think you really have to get to the right doctors? And I mean, it's a combination of both, but how much of it is just the power of the mind?
Well, I think it is the power of the mind. I mean, I think for me, I did have a number of surgeries. I missed 4 or 5 years of my career during my prime. And I really feel the turning point for me was when I took ownership of my health. And what I mean by that was I stopped putting all this trust in the doctors and the team doctors, and finally said, okay, I'm going to take control, and I'm going to try to find the answers to these questions. And so that sort of led me on a journey to finding the right doctors and really getting the right answers. You know, why is this thing continuing to give me problems? Why is it not healing? You know, why did it break in the first place? You know,
Right.
these were all things that hadn't been answered up until that time, and you know, so it was actually you know, and I think taking ownership still applies. Even now that I'm healthy, I'm still constantly trying to figure out the right thing to do to stay healthy, to go out there and be competitive on the court. But also when I'm done playing, I still want to be active. I still want to be able to play with my children and hopefully my grandchildren one day. And so it's not just about playing basketball, but it's about living hopefully a healthy, hopefully a long life, you know, as I go forward.
Absolutely. You know, I love the way you use the word taking ownership, because so many times patients, they come see us and they say, what must I do? And, you know, sometimes it's medication, and sometimes, well, you've got to go diet and exercise. And the fact is, unless somebody's part of the program, unless they're really empowered to understand what's going on, why am I here in the first place? You really never get properly healthy, because it's a team approach, and I'm sure you know what I mean by that. The doctor is only there to help you. The doctor can't exercise for you. You've got to be part of the treatment, and part of the treatment for most people is obviously taking it on board completely, because they're the ones that actually are going to benefit the most from the therapies. Let me introduce Dr. Suneil Jain. Welcome to the show, Dr. Jain. It's Dr. Jain, right? We had a wonderful conversation yesterday, and I'm really excited to have you on with Grant. Thank you, both of you, for coming on the show. Dr. Jain is actually a board-certified naturopathic physician in Arizona. He received his undergraduate degree in biology from the University of Virginia and completed his doctorate of naturopathic medicine from the Southwest College of Naturopathic Medicine. And then he went and completed another 2 years of general practice training in Scottsdale, and he now is medical director and co-owner of Dermacare Laser. Suneil, Dr. Jain, welcome to the show.
Good morning. How are you?
I'm good, and thanks for coming on. We had a wonderful chat yesterday. Just to introduce yourself, why don't you tell us what is naturopathic medicine, and one of the most important things for me and why I do this show. And just to remind the listeners, I'm Dr. Dennis Goodman. I'm a clinical associate professor here at NYU, and I have been very steeply and well-trained in what I call traditional Western medicine. I'm trying to be humble, but I have 7 board exams. And then I realized that I need to understand what's going on out there, because there's so many people who don't get better with the approaches that we have. And they go out there and themselves find physicians that offer modalities and often therapies that we're really not offering patients. And that's the whole science of integrative medicine, of functional medicine. And physicians like yourself, Dr. Jain, are really the people out there that are holding the banners and really teaching us on the side of Western medicine how much there is out there that we can do for patients in a very natural, holistic way. We had a long discussion yesterday about how food is so important, and being healthy is really about what you eat. So how did you come to this?
Yeah, that's correct. Well, actually, like naturopathic medicine is a system where we try to identify the root causes of disease, and it's a whole body approach, looking at the mind, the body, and that's separating the two together. We're trying to bridge the gap between holistic and traditional allopathic medicine. And so when we talk about diet, that is the foremost important thing that we can work on and actually control to try to better ourselves and enjoy a more healthier lifestyle.
You know, when you use the word diet, it's got this terrible connotation these days. You know, people actually, they hate the word because it's got this idea that somehow, you know, you've got to diet when you lose weight. And I always try to stay away from it. I talk about having a food plan, having a food management approach. And I think the important thing is that we get the message across that so many diseases out there, chronic diseases, atherosclerosis, connective tissue diseases, arthritis, cancer, are related to the bad stuff that we put in our stomachs from an early age. Do you agree with that, Dr. Jain?
Oh, that's absolutely correct. And when I say diet, I'm talking about the literal meaning of eating every day. It is a lifestyle change.
Right, that's my point.
And the lifestyle that we're focusing on is one that if you look at it every day, then you really reduce the chances or delay the chances of getting these chronic diseases. Chronic disease nowadays is a huge part of our overall healthcare and it's responsible for many of the top causes of death. And controlling the development and progression of chronic disease via the diet and lifestyle changes really can make a big difference in helping with inflammation and oxidative stress. Those are the main factors there in the chronic disease process.
And the important thing is that people need to realize you can do it for yourself. This is something that you can take on board yourself, and the key is that when you do it, you'll end up making a huge difference, because these lifestyle changes can help you prevent getting these terrible diseases that force you to go into a situation where you're with doctors who are going to prescribe medication, you'll end up having surgeries, you'll end up having procedures. And the whole emphasis should be, and it's so important that if we get people to understand that the stuff that we're eating that's bad for you creates a situation that there are toxins that get released into our body, and they damage our cells, they damage our blood vessels, and they damage our organs. And so much of what we're doing is our own, we're doing it ourselves. We're putting foods into our stomach that actually are toxic. We understand that there are pollutants out there. There's a lot of stuff out. People understand that they shouldn't be in a place where there are pollutants, and a lot of pesticides, unfortunately, are pollutants. But there are a lot of pollutants in food, not because they're external pollutants, but they form biotoxins in the body, and they get into the gut and they cause damage. So that's what we're talking about today. So let me just ask you, Grant, how did you land up with Dr. Jain? You're a superstar athlete. You must have asked yourself so, and you brought it up initially in the program. How did this happen? How did I get a fracture in the first place? How did you land up going to Dr. Jain?
Well, actually, a teammate of mine, Steve Nash, who I think was and still is a client of Dr. Jain. Not to put Steve's business all out there, but he recommended Dr. Jain. And so my wife and I, both about a year and a half ago, we first went into his office, and we were familiar. We had worked with naturopaths before and holistic medicine, and but instantly we connected. First of all, I mean, I think first and foremost we're close in age and we're friends. So that's something that has struck over the last year and a half. But more importantly, just, as I go throughout the course of the season, things come up, whether they might be, soreness, injuries. Just maybe a couple of weeks ago, I was suffering with a respiratory infection or some sort of cough or what have you. It just seems like we're able to work together and try to come to a solution on trying to figure out what's going on. Obviously, the importance of eating right and understanding and having a good relationship, one, with food, but just understanding, like you said earlier, the effects that food have on you and how you feel. And I think as a professional athlete, you're so in tune to how your body works and how your body feels. We have a great training staff with our team in Phoenix, and you learn so much about training and working out and lifting, but there's not really a lot of education, at least in professional sports, about diet and nutrition. And I feel that within the last year and a half and having the opportunity to work with Dr. Jain, I've really taken some huge strides in understanding how my body works and what foods work right with my body, and really been able to maximize that and go out there and play at a high level. And at the age of 38, someone who, at least in my world, that's considered old. I feel like I've sort of found the fountain of youth, and I feel better. I understand how to recover, how to eat the right foods, how to stay away from sugars. Staying away from foods that are processed or have a lot of sugar, and how sugars create inflammation. And so I don't pretend to be a doctor by any stretch of the imagination.
Grant, I wonder when you retire from your basketball career, will you come and be a nutritionist in our office? I mean, we'll be so busy, they'll come and see, because you're talking like, this is what it's all about. It's about getting people to eat healthy. And you've come to a realization that a lot of these things that you were eating before, I mean, you're a superstar athlete, so I think there are times you must be stressed. It's very easy to go and just get a fast food meal. and think that you're replenishing your reserves, and you're really not. So, Dr. Jain, tell us what you did. I'm just, and use Grant as an example. I mean, he's a high-performance athlete. He's got to be in tip-top condition. He's getting oxidative stress repeatedly. Would you agree with that, just in terms of his physical expenditure and what it takes to get through a game, and what it takes in terms of the stress all the time of having this, tremendous, I'm sure, stress around you to perform at such a high level at all times. And then on top of it, he's come through all these injuries. So how do you approach it? Why don't you tell the listeners? I mean, Grant's an example of somebody that's come to you, but I'm sure you've got many, many people who come to you. Where do you start?
Yeah, so basically when someone comes first in our office, we do a very detailed history. The appointment's about an hour and a half long, and we kind of really find out every single thing that may be going on with them, whether it's off balance or just different things about them personally. And usually I like to start with some kind of a blood test that is looking at and identifying food intolerances, food sensitivities. And at that point, then we can basically start the patient on a diet program, and I have them do that for about 2 or 3 months. I usually don't even prescribe any supplements or medication unless necessary within the first 4 to 5 weeks, because I want to see what changes occur specifically with the diet and the removal of the intolerances. And so, like in Grant's case, we also, there's some other functional type of testing that we can do. And one thing that is very important, as you mentioned, with professional athletes, actually all of us in general, is something called oxidative stress. And oxidative stress is responsible for changing it can actually change our DNA, affect our mitochondria in the cells, the energy workhorses, and really just cause destruction where you're promoting inflammation chronically. You can affect the way the patient sleeps, the way they function, the way they perform, and it's just overall just helping prevent the breakdown of the body.
Absolutely, and I think you mentioned something that's so important for people to understand, that the food that you eat can actually affect your DNA and affect your genes. So we're understanding now that you can actually change the way your DNA functions based on what you eat. And it's been, the whole field now of epigenetics is incredible, and people like Dr. Jeff Bland out there are busy explaining to people what functional medicine is all about. And we actually can it's the food, it's the interaction of your nutrition, your environment with your DNA that you're born with that actually determines whether you get disease or not. A lot of people think, well, it's the family history, there's nothing I can do about it. But it's actually such a strong interaction with what you eat that determines whether or not you're going to go on and actually develop that disease. There may be a predisposition, but you can do a lot about it in terms of preventing it, just in terms of what you eat. So let me ask you, do you think that most people, did Grant have an intolerance? I hope you don't mind discussing this, Grant. Did you find that maybe there's some food he's been allergic to for a long time and you cut that out? Or does everybody, do you tell everybody, look, sugars, white bread, a lot of people are gluten sensitive, they don't even know it? Or do you find specific allergies with specific foods?
Yeah, no, definitely. There were a lot of foods. For me, initially, we've done a few tests in the last year and a half, but there were some foods. I think initially salmon, chicken. These were foods that are considered healthy, foods that I ate a lot of, and at the time weren't necessarily good for me and my system. And so that was,
How did you know that, Dr. Jain? What did you do? Is it a skin test or?
It's actually it's a blood test, and what the test is looking at is basically it's the white blood cell reaction to different food antigens. When we think of more of the traditional allergy testing, that's done via the skin, but that's looking at more of an immediate type of a reaction, an IgE reaction to a food. A particular food where you eat it, and within 5 to 10 minutes you're either breaking out in hives or your throat's swelling, more of an anaphylactic type of a reaction, more of a life-threatening type of a reaction. Sensitivities are different, and with sensitivities, it's basically more of a delayed reaction to a food where half an hour, a few hours later, 24 hours, 48 hours later, you're reacting to the food, and it can exhibit specific symptoms from just bloating or fatigue and joint pain, chronic headaches, eczema, things like that that don't necessarily affect you in the short term, but over the long term, they just break the body down.
So what did you do specifically in Grant's case? So he's chicken and salmon, and what else did you tell him that's made a big difference?
Yeah, well, there was a few other things. I mean, gluten was an issue as well, and I think just significantly cutting down to virtually nothing the amount of refined sugar in the diet, I think is critical as well. Inflammation is definitely affected by the sugar intake, and we know there's a lot of documentation out there on how sugar actually suppresses white blood cell activity as well. And so when you can cut out some of the main ones like the gluten and the sugar, and then really make it a little bit more specific with the salmon and the chicken, it really just provides somewhat of an anti-inflammatory type of a diet specifically for him.
I think there's so many people. Sorry, go ahead.
No, something that I was going to say earlier is that something I always tell people is that food affects physiology, and that's something that if we think about it from just a medical perspective or just from a layman's perspective, when you think about food affecting physiology, that opens up and really symbolizes the true meaning by you are what you eat, because you can turn off genes and responses and allow the body to detoxify and heal a lot quicker just by changing what you eat.
Well, the easiest analogy for people is understanding if you buy a high-performance car, you're not going to go and put diesel into it. You're not going to go and put the wrong gasoline in because you just know you're not going to get the performance. And it's the same with the body. You've got to provide the absolute best nutrients to get best performance. There's so many people out there that I think are sensitive to things. They don't even know it. I recently went to Australia, saw an old friend of mine from school after 40 years. Now, he was a tremendous athlete, but he was so skinny that we called him String. And he was just one of the thinnest guys you've ever seen, a really good athlete, though. He told me they finally figured out in Australia that he has celiac disease, which is a gluten sensitivity. All these years, he was eating the wrong food. And as soon as he stayed away from gluten, you should see him. He's a different guy. So I think that's important to realize that sometimes when people are really skinny or they're not putting on weight, you've got to check and see if it's basically a food allergy. How many people that you test out there have actually got sensitivities and you tell them something that they never even realized?
Quite a bit, actually. Most people have sensitivities, and it's kind of because of how our modern lifestyle is, how we've kind of adapted to it. Kind of eating the same foods over and over, eating things that are quick, a lot of processed, refined stuff. You tend to find corn and soy in almost any type of processed food. And so the more the body is subjected to the food over and over and over, the higher the chances of developing a sensitivity to it.
So, Grant, what have you done that's made a major change? I'm just interested. I mean, did you feel that this change has changed you how you feel, or has it actually changed performance?
I think a little bit of both. You mentioned earlier that, about fast food. I mean, not that I ate fast food, but I think with the amount of, the amount of calories we burn, I could eat whatever and probably would not gain weight. So it's not necessarily about gaining weight, but about how you feel. And, I think as you get older, it's harder to recover. We play, in some cases, 4 games in 5 nights in 4 different cities. So like I said, you really are in tune and understand how you feel. And, the more days that you can feel good, the things that you can do to help you recover from game to game are huge. And so really, instead of looking at glucosamine and some of these other over-the-counter substances you can buy that certainly help, the one thing that was the obvious was the diet and the food and the things that you put into your body. So I noticed a huge difference, and I think I played well. I mean, I've had probably my best season since I've been out here in Phoenix, and just understanding that whether I'm at home where it's very easy to get the right foods, but also going on the road, and making the right decisions when you're ordering food, either room service or going out to eat with your teammates, and not being intimidated by a menu or the fact that you're not at home, and just making those right decisions. And so I've been very disciplined in that regard, and I feel great as a result. And so, I'm just going to, continue to do it, as long as I play, but also when I'm done. I like feeling good. I like to feel good. I like to not have soreness. I like to be able to be active. So it's not just about being an athlete and playing basketball, but it's, it really is hopefully something that I will continue throughout the rest of my life.
I just want to remind people you're listening to Dr. Radio on Sirius 114 and XM 119. I'm Dr. Dennis Goodman, Clinical Associate Professor, and it is my absolute pleasure to have on board as our guest today Mr. Grant Hill, an NBA superstar with the Phoenix Suns, and Dr. Jain, he's naturopath, and we're talking about the importance of eating a healthy, we call it diet, but it's really a food program. And here's Grant telling us what a difference it's made to his life to take on board the importance of being disciplined and avoiding foods that are actually going to make you feel lousy, that are going to cause oxidative stress, and that are actually going to cause deterioration of your blood vessels, of your organs. They affect your liver, they affect your brain, they affect your heart. So, Dr. Jain, I want to congratulate you because I think it's really huge that here we are, we got Grant Hill telling you that he's actually feeling better. I mean, high-performance athletes have a lot of access to anybody and everybody, and they've got team physicians. And it's incredible that he sought you out, through a friend, Steve Nash, who sent you. And I think that what I want to get to, Suneil, is where do people go? They're listening on the radio and they're thinking, okay, you know what, I'm motivated. I do want to make the changes. And it's not just we'll stop eating sugar. Where do you go if you really want to sit with somebody, talk about your diet history, talk about what you're eating, see what it's affecting you? Of course, I'm always telling people go to your physician and be checked out and see what your risk factors are. But if you really want to focus like you are on actually what people are eating and the changes they need to make, the sensitivities to food, where do you tell people to go?
Well, there's actually different organizations. In my profession, we have the American Association of Naturopathic Physicians, which is very similar to like the American Medical Association, the AMA. And so you can go onto that website and really locate a doctor that's close to you. Then there's other organizations like the American Academy of Anti-Aging Medicine, the American College for the Advancement of Medicine, where they have MDs, DOs, naturopathic doctors, who all share similar type of knowledge and experiences, and those are really the avenues that people should approach, if they are interested in taking kind of control of their health and finding out, how to better themselves.
Absolutely, and I want to be very fair. In traditional medicine, of course, we're all talking about the same thing. We're all very well aware of stress to the system from multiple causes and risk factors, and how important it is to eat. So many of us in my practice, I'm at New York Medical Associates and head of Integrative Medicine. We have a nutritionist. So I'm very focused in on what you're talking about. You don't have to see a naturopath, but I think it's important when Grant said it. You have to take on board, Grant. You said it earlier. You said you actually you were empowered. You said, what do I need to do? You got to find the right place where you're going to be asking these questions, getting answers to these questions about what you should eat. While I've got you, Dr. Jain, I just want to bring up this issue of, the challenges between traditional and holistic medicine. And let's bring Grant into it because, it's so easy to be told these are the doctors you have to see and you don't need to go see those guys. They're kind of flaky. How do we bridge this gap so that people like Grant, who's a perfect example, he's got access to the very, very best, but he found you and it made a huge difference to his life. So we're talking about here a person who bridged the gap himself between a holistic naturopathic physician and traditional medicine, where he's obviously was helped very much by multiple surgeries. If you don't have a surgery on an ankle that's fractured, you can't function. So there's an example. You need both sides to come together to get maximal performance, maximal function, people feeling their best. Do you struggle with this challenge? And one of my challenges is, and one of the reasons I do this radio show, I want to bring people together to talk about this and find ways that people can have these discussions, talk to each other, and find out where to go so that they can actually not be left out, lost, trying to figure out what to do.
Yes, well, obviously traditional medicine saved my career. I had a fractured ankle and had a number of surgeries to fix it. Ended up getting a staph infection after the fourth surgery. And
MRSA, right? I think you got MRSA.
Had MRSA, exactly, and which was very scary. and had a skin graft, and so the fact that I'm still playing and is pretty remarkable, and I credit some awesome doctors for doing that. I think I'm somebody who's benefited from both. I think going through that whole ordeal really sparked something in me, and sparked, like I said, the whole idea of taking ownership and not just being, satisfied with, okay, now my ankle's healed, but there's got to be more. Let me learn more about how my body works and how to prepare my body to go out and perform at a high level. One of the things that I've been introduced, and like I said, is I've been so conditioned, and certainly, medicine has a place. I don't want to, be down on medicine, but if I instantly have a problem, or if I have a cold, or I feel like I'm getting sniffles, or, you just take a pill or some sort of, medication. That's sort of how I've been conditioned in the past. And, one of the things is, okay, let's evaluate here. Why is this? Why am I down? Is it because maybe I'm slipping on what I'm eating? Maybe I'm not getting the proper rest. Maybe there's some alternative approaches we could take before we go down that road. And so, it's been sort of life-changing for me, and I've found that I don't really need to take, I don't need to take the medicine. I don't need to get on the Z-Pack. I don't need to take Advil, which 2 or 3 years ago I was taking, 3 or 4 before every game. And so, and my body responds and it feels well. And so I can't speak for everybody else, but for someone who's, like I said, a professional athlete who understands and is very sensitive to how I feel, it's been unbelievable. And so certainly those other approaches, I'm not eliminating that, and I'm not saying those are wrong, but I'm saying that there's some alternative ways, and that's what I've been able to benefit from working with Dr. Jain over the last year and a half.
Grant, I just want to tell you, I absolutely love what you just said, because it's so important. Are we still on? No, it's so important that, and I teach medical students, and I say to them, the most important question you got to ask when somebody comes in with whatever it is why. And you've just addressed this whole issue. People can come in with recurrent infections, and you can give another Z-Pack and another decongestant. But the question is, why are they getting repeated infections? And that's because their immune system is stressed and their immune system is depressed. And I love the way you're pointing to the fact that that if something's happening like that, you've got to get to the underlying cause, and the underlying cause is oxidative stress to the system. That's depressing your immune system, and that's where people like Dr. Jain come in. And it's wonderful to hear how you've taken on board the fact that if I keep my system so that the immune system's performing at the best it can be, I'm much less likely to get sick. And that is what it means to have the lifestyle changes, to eat the right foods. And Grant, it's just wonderful to hear someone like you who's really understood this concept. And I feel so very honored that you're on the show, because I wish we could get everybody to hear what you've just said. Because as a physician in integrative medicine, I'm sure Dr. Jain will agree, if we could get people to understand that when you get sick and you have a problem, yes, you can treat it symptomatically. You can put a Band-Aid on, you need an antibiotic, but if you don't address why you got there in the first place, you get it again. Yeah. And I think what you're saying is you've changed your lifestyle. What other lifestyle changes have you made, Grant? I know you're talking about food. Is there anything else? Are you sleeping better? Are you making more time to rest?
Yeah, well, that's another thing, the importance of sleep. And it's something that, it's about recovery. And I think so many of us go through life and we don't get enough sleep, and, we're deprived of sleep, and we rely on coffee and caffeine to get us going in the morning. And so, I try to get, as much sleep as I can. And certainly with young children, it can be a challenge. But simple things like turning the TV off, and it's one of the things that I used to always fall asleep with the TV on. Making sure the room is dark. Just okay. Now it's time to go to sleep. Making time to go to sleep, if that makes any sense. But that's so huge. Staying off my legs. Not running around, okay, we're on an off day, we're on the road, I'm going to go to the mall, or I'm going to, do these various things. I'm going to get my rest, and that's huge for me as a professional athlete. But, on the flip side of things, I will say this, I do feel a lot better And there's that tendency and that, want to do more, because I'm eating right, because I understand my body. There is that sort of temptation to want, okay, today, let me play some tennis with my wife today on an off day, and which may or may not be the best thing to do right now in the middle of the season, but I feel so good.
It's a great thing to do for your wife and your marriage. Those are very important, this whole idea of balance, Grant.
Well, we're pretty competitive, so maybe it's not a good thing for our marriage.
Okay, well, you can maybe you put her on your team or something, and you can play against them.
I'll tell you this. Just one thing, and this is probably not answering your question, but I'll say this. 2-3 years ago, when I would get up in the morning, the first thing I would do is rush to the shower, and obviously, to get clean, but to just get the joints feeling good, get the hot water from the shower, to come down on my legs and my ankles and my knees, and that was like the first thing I would want to do in the morning, because I needed it just to get my body going, and now I don't need that. Now I wake up, I feel great.
Amazing.
I feel good. Now, once a blue moon, I might have a bad meal, and I might feel it the next day. But for the most part, I hop out of bed and I feel good to go. And so, it's just like when I say it's really been life-changing, it really has been.
I just want to take a break. I just want to remind people you're listening to Dr. Radio on Sirius 114 and XM 119. Our email address, if you have a question, is docs@siriusxm.com. We are talking to Mr. Grant Hill, superstar NBA player, and Dr. Suneil Jain. We'll be back in 2 minutes.
This is Dr. Radio, Sirius 114, XM 119, and on the SiriusXM app for smartphones.
Welcome back to the show. I'm Dr. Dennis Goodman, Clinical Associate Professor at NYU. And, excuse me. Welcome back to the show. I am talking to Mr. Grant Hill, who is a 7-times NBA All-Star, plays as forward for the Phoenix Suns, and also he's naturopathic physician, Dr. Jain. It's a pleasure to have you both on the show. Grant, you just mentioned something, and I just want to touch on this, and then I want to get to another topic, which is the whole idea of sleep is so important, and so many people make the mistake. Welcome back to the show. You're listening to Dr. Radio on Sirius 114 and XM 119. I am Dr. Dennis Goodman, and I'm talking with Grant Hill, 7-times NBA All-Star, plays for the Phoenix Suns, and he's naturopathic physician, Dr. Jain. And we're really having a wonderful conversation about how important it is to eat right. It doesn't matter who you are, and to make the right lifestyle changes to stay healthy. Grant, you mentioned something, and I just want to throw this in quickly. So many people have trouble sleeping. And when you talk to them, you find out that just before they go to sleep, they go check their email, or they listen to the terrible news that we have to hear every day. You made such a great point that you've got to go through a process of slowing down when you want to go to sleep. You can't stimulate your brain and then get into bed and suddenly figure out, why can't I sleep? So it's very, very important. Darken the room. Don't go look at your emails and turn on your computer before you're trying to sleep. And don't turn on your TV set and see the terrible things that are going on around us, because that isn't going to help you sleep. Anyway, I'm not going to get into that. I just wanted to throw that in. What I do want to talk about in the last part of our show with both of you is, this tension between traditional and holistic medicine. I really don't believe there should be any tension. There should be a real embracing on both sides. And I want to ask both of you to talk about the fact, have you felt any tension? Grant, do you find your teammates are saying to you, wow, you seem healthy, you're not running with us to eat fast foods? Are they taking it on board? How about your team physicians? Are you talking to them about Dr. Jain, and are they receptive to what you're doing?
Well, my teammates definitely, their clients, they work with, or patients rather, of Dr. Jain as well. And he probably has maybe 6 or 7 guys that come in to see him. And so I think they understand and appreciate, sort of the holistic approach. And now they may not be as diligent with their diets as I am, and maybe Steve Nash are, but they're young; they can get away with that. But no, they definitely understand the importance, and they've really embraced it as well. And our team doctors are certainly aware. I'll be honest. I think just in general, and this is my observation, and I'm not sort of calling out my team physicians. I'm just thinking in general. I think for the most part, alternative medicine, holistic doctors embrace sort of the traditional Western model. I don't know if the traditional Western physicians embrace the holistic approach, and that's sort of what I've seen through the years, and maybe I'm totally inaccurate, and I applaud you for embracing it and understanding that there's a lot of positives and benefits to both approaches. But from what I've seen, I think, there's a tendency to look at this holistic medicine as not, the right approach, or the right way to approach illnesses or what have you, and that's kind of what I've seen, and that's kind of why I'm on here, because I'm a big believer in it. I'm someone who's benefited from it, and I think there's a place for both.
Absolutely. And I think just to make it clear, Grant, and you'll be pleased to know this, there are more and more physicians like myself that are interested in bridging this gap and learning about holistic medicine. There's a whole field now of integrative medicine. There are many institutions around the country that have departments in integrative medicine. I was at Scripps Clinic, and they have a fantastic department there. Mayo Clinic, Duke, NYU's looking at doing it. So we're understanding that we need to come together And it's a wonderful thing to see both sides talking to each other and learning what we can get from both sides. I think one of the problems that within holistic medicine, some of the stuff that gets done in there does not have any scientific basis, and you land up in a situation where maybe some of the stuff is what I would call so off the wall, so flaky that traditional physicians get put off. And so it becomes a place where some people can do some very weird stuff. I don't want to mention it on air, and I don't know whether it's helping. And sometimes they're getting charged a lot of money, and then the whole field sort of gets pulled down by that. So, Suneil, Dr. Jain, where do you come in on this? Clearly, I mean, I just love what you're doing, and clearly you're right on track. Do you come from a place with traditional medicine in your family, and how did you get to realize that you really want to get into the holistic lifestyle nutrition approach to disease?
Yeah, I actually, growing up, I was exposed to traditional medicine quite heavily. Lots of family friends, relatives, my sister, brother-in-law in traditional medicine, lots of cousins in traditional medicine, and various specialties. And there's most definitely a time and place for medication or surgery, and it's about bridging the two sides together. And myself personally, I had a few digestive problems growing up as a child, where we went to numerous doctors and specialists, and really never really got anywhere. And I remember my parents taking us, we went on a family trip to India when I was around 8 or 9 years old, and I saw some kind of laymen who practiced homeopathy, and they kind of had made some suggestions dietary-wise and given me a couple of remedies. And you know, I was thinking, how can these little pellets do anything for me? And lo and behold, the issues went away. And when we came back to the United States after our vacation, it was, you know, I was a different person. And so as a young child, I kind of saw that, you know, here we have all this wonderful medication and facilities and whatnot, but it really was not helped or cured, quote unquote, until that visit to India. And so from that point on, I really had a genuine interest in more of the integrative, holistic, alternative type of approach, and really just combining the two sides together. Because there, like I said before, there's a time and place for both. It's just trying to recognize when it's appropriate to use the which type.
Absolutely. You know, the word alternative, I don't like it because I think it should be complementary. It should be essential. What you're doing is essential to good health. Let me ask you this. Do you feel, and obviously I think it's so important for people to understand that a lot of disease processes can be reversed. By making these changes, by reducing your oxidative stress, diabetes is a perfect example. We spoke on the phone about something, you know, yesterday I told you about a cousin of mine who had, you know, a rodent ulcer. I think it's a type of cancer on the tip of his nose. It's a basal cell cancer. And they live in South Africa, and he saw somebody who told him first he went to the dermatologist who told him that he's going to need a deep resection and a skin graft. And then he saw a homeopathic physician, and he told him, well, let's try this ozone cream. Well, they called me to tell me the dermatologist is shocked out of his mind because he did a biopsy and the cancer's gone. Now, I'm just bringing that up, and I'm not for 1 second saying that you've got to go do this out there, but I'm just saying there are therapies out there. We've got so much to learn, and you were telling me that ozone is one of those things out there that when we get to study it, we're going to find some amazing effects. So before you mention ozone, I want you to tell me, how do you feel about reversing disease with the type of, you know, programs and dietary changes, nutritional programs that you come up with?
Oh, I think that's absolutely possible. We see it all the time in our practice. A lot of chronic disease, people just take, once they get their diagnosis, they've been labeled and branded, and now you got to follow, XYZ protocol where you're taking this medicine and that medicine and maybe another medicine to combat the side effects of the first two.
Maybe 10 medicines sometimes. I mean, people are taking huge numbers of medicines, and we call that polypharmacy with a lot of interaction. We're not even sure that they can tolerate them, and a lot of times they don't take them. Exactly.
And a lot of times you're actually making the underlying issues worse by taking the medications. But yes, I think it's extremely possible. We've said it over and over on the show today, but diet is the most critical part of this whole process. Obviously, there's other things, controlling stress, exercising, that are important. And sometimes it's necessary to take some supplements or necessary to take a medication. but it really has to start with the lifestyle change. And I've had numerous type 2 diabetics come into the office who are on multiple medications, not even realizing the importance of how they can control their blood sugar with just the diet. I mean, it seems obvious to a non-diabetic patient, but to a diabetic, kind of instructing them, showing them how the refined sugars and sometimes these artificial sweeteners even can really mess with their blood sugar, and start influencing them and educating them and getting them to change their diet and recognize that they can control their blood glucose, and then it starts reducing the dependence on the medication, and so it's extremely possible.
You mentioned supplements. I think when we spoke, I asked you how much vitamin C should I take, and I loved your answer. Why don't you tell people how you feel about these supplements in terms of, some people are taking 20, 30, 40 supplements, and the question is, do we need them?
Yeah, that's right. I think supplements are something that people can sometimes go overboard on. Theoretically, I can tell you about 250 things that are good for you to take every day. That doesn't really make sense. You want to get majority of your vitamins and minerals from your food, from the diet. And when we talk about vitamin C, it's like, well, instead of taking 500 milligrams or 1,000 milligrams of some isolated form of vitamin C, like L-ascorbic acid, why not increase like fruits and vegetables like kale or papaya or cherries, things like that are high in vitamin C, and you're getting that in a form that is easily recognizable by the body, and it's not really foreign. When we start isolating these specific compounds, you're almost turning it into a drug because they don't have all the other cofactors along with it, all the other constituents, the other makeup of the vitamin, to make it work the way nature intended it to.
Right. A lot of the times the vitamins aren't being absorbed if you've got problems with digestion.
That's right. We have people are taking all these different types of vitamins, and it's really not regulated, and most of it is synthetic, and so the absorption rate of those vitamins are extremely low.
I think there's certainly important vitamins and minerals that we need to get in our body, and I always tell people, first the best way to do it is take the right foods. But most people are not getting the right foods, and they're not eating the way they should. And then the question comes in, well, are you better off taking the supplements than doing nothing?
Well, see, but you're looking at someone who doesn't want to take control of their health. Obviously, if they don't have the means to do so, then doing a vitamin is going to be better than nothing. But that's kind of a cop-out, in my opinion. You really want to get as much as you can from food, and unfortunately, a lot of the modern farming practices and the processing of the way we eat or the way we farm our vegetables and fruits, it's just we're already somewhat deficient in nutritional content compared to other countries, and so it's really, really important to stress eating a very well balanced nutritional diet and get your nutrition from that. And then, of course, if that's not possible, then you want to get it in somehow.
What about organic foods? Are you one for as much as possible to get the organic foods and stay away from the pesticides?
I think it's very important to eat as much as you can organic. I don't think we necessarily have the best systems in place. It's interesting that we can pasteurize juice and still call it organic. The laws that are in the United States are being refined as we speak, but I think it's still better than eating foods that are pesticide-ridden, because we do know that those build up in our bloodstream, in our fat tissue, and can cause problems over time. It's interesting to note that 99% of children born today we can still find DDT in their fat. Why is that possible when that substance was banned in the early 70s?
Right. You know what? It's interesting. Sometimes they're adding vitamin C to the orange juice, which just shows you that clearly that the pasteurization is you're landing up where the vitamin C that was in there is getting lost, and you have to add it to say that it's you see vitamin C fortified.
Right,
do you agree with me?
Right.
So sometimes the processes with these foods that are supposed to contain these ingredients is actually getting rid of the good ingredients.
Right, absolutely.
Grant, I want to come back to you in the last few minutes of our show because we're going to sum up. I mean, you are a high-performance athlete. You said you're at the top of your game, which is absolutely wonderful. And I think what you're saying is you've changed your lifestyle. You've taken on board. You've taken control of your life. I love the way you said that. When did that happen? How old were you? I mean, how many years do you feel, wow, I'm empowered, I've taken control of my life? Is it a few years, or have you been doing this?
It's been a while. I mean, it's been a while. It's been, I had a bunch of surgeries, from 2000 to 2004. And around 2004, that's when I kind of finally took ownership of my health, as I like to say. And obviously it started with, finding the right doctors and getting the right answers, and really wanting to get back and resume my career. And since then, it's been just about learning about my body and learning about, what I can do to go out and perform at a high level. And I think we made some big steps. I've always kind of, at least in the last 5 years, been interested in diet and eating correctly. But like I said, I think I really, made some giant gains in the last year and a half after meeting and working with Dr. Jain and just understanding, understanding food and understanding what foods work right with my system. Right. And when to eat and all these different things.
Which is what he goes to. I just want to ask you, Grant, talk about stress. You must have stress in your system at times. There must be a ton of... Are you doing other things? We tell people go exercise. We can't do more exercise than you're doing. Are you finding other ways to reduce your stress? Do you meditate? Do you do yoga? I know you're playing some tennis with your wife. I'm sure that helps. But what else can you tell people in terms of stress management?
Oh, there's a lot. I mean, massage therapy, acupuncture. I do it. I don't necessarily do yoga during the season. But, yeah, I mean, even I heard you guys mentioning earlier, one of the things that Dr. Jain recommended to us, we put a jacuzzi in our backyard, and it's, ozone. The water is treated,
right.
Instead of chlorine, is ozone. And is that correct? Am I saying it right, Dr. Jain?
Yeah.
And so I'll go and soak in the jacuzzi, and, now you're having, water that has all this oxygen in it that, I notice a difference, and I enjoy it. So, yeah, I mean, there's a lot of things. I get in the pool. I do a lot of movement stuff, active recovery.
Grant, so I'm sorry I have to cut you off. I just want to say again, it's been an absolute pleasure to have you both on the show. We at Sirius here and me on Dr. Radio, you two represent what it's all about in terms of bridging this gap. You're welcome back anytime. It's been a pleasure to have you on. Thanks for taking the time. I'm Dr. Dennis Goodman, Clinical Associate Professor at NYU, and I look forward to seeing you again and talking with you in a week. Bye. Hello?
Yes.
I just wanted to thank you both. Grant, are you still there? No, he's gone. Thanks so much, Suneil. You were great, and I really want you to come back because, I just felt with Grant there we had to sort of let him talk about how he's taken this on board, but there's so much for us to talk about. So thanks for coming on. I don't know if you had any other thoughts that you wanted to, how you would have done anything different?
No, I think that was great. I mean, you kind of hit home on the key point of taking control in diet and lifestyle change, which is the most important part of what we've been doing and trying to work with these athletes and really get them to recognize that. And and he does so, and he really works really hard at that. And I think it was a testament on what the show is about.
Yeah. So please thank him personally. I know that you're going to talk to him and. He came on. I just think it's great to hear him talk. Like, it's kind of like, wow, if our patients could talk like this, but, I can feel like, you don't just have them come in and do this, but you really get them to take responsibility for their health.
Absolutely.
And that came across loud and clear, and I'm sure that's kind of one of your goals and missions on every single patient.
It is, and I tell everyone, it's like, I'm not doing anything. I'm just giving you some tools, but you got to do all the work.
Yeah.
And if you do the work, you're going to get rewarded for it if you don't do the work.
Yeah, that's actually what I was trying to say. I wish you would have put it like that, but that's absolutely right. They can't do it you can't do it for them, but you can actually guide them on, and here are the tools, and if you do the work, and he's clearly, he's playing brilliantly with 5 surgeries. It's actually incredible. Yeah. Anyway, you're obviously a wonderful physician and a caregiver and a healer, and I'm glad we've made contact because we'll have you back on the show, and thank you so much for coming on. And please is it Kristen or Kirsten? It's Kristen.
Yeah, Kristen.
Yeah, I think she sort of connected us with Grant, and just let her know. We'll send her an email as well. So I'll send you an email, and we'll be in touch, and we'll get you back on.
Sounds good.
And if you come to New York, please come and visit.
I will absolutely do that.
All right, take care. Bye.
Bye.